13, 2 weeks before Thanksgiving, highs of 80 today. Some rain moving in tonight, 20% chance for showers, maybe spotty showers tomorrow. Highs of 76 over the weekend, highs near 70, 40% chance for rain. Some of that rain, if the cold front stalls out, could help with that fire out at New Orleans East. So they're saying maybe a possibility of 3 to 5 inches of rain. You don't want anything to flood, but it would be good to put that fire out. Dr. B joins us, our friend, Dr. Brent Wallis, Chief Medical Officer of People's Health. Millions of people get the flu every year, but that doesn't mean it is not a serious disease. Dr. B from People's Health going to talk about the importance of getting an annual flu shot and dispel some common flu shot myths. How you doing, Dr. B?
Hey, Tommy, I'm doing great. How about you?
I'm okay. Getting ready for Thanksgiving?
Yeah, I can't believe it's right around the corner.
It's
I
flying
still don't
by.
have a menu.
It is flying by. Let's start with the basics. What is the flu?
Sure. So the flu is it's just a contagious respiratory illness, and it can be caused by a lot of different types of influenza viruses. And all of them actually affect the nose and the throat, and sometimes, in severe cases, they can affect the lungs. They cause a lot of inflammation and redness that can occur in your nose and throat. And the symptoms can be really mild, kind of like a cold, but they can also become very severe. You can get fever, you can have cough, fatigues, even chills, and then really a hallmark of flu is body aches. Really kind of feels like you got beat up.
It seems like it does spread pretty easily. How does it spread?
Yeah, flu spreads extremely fast, especially in confined spaces. And what it is it's spread through personal contact. So whenever someone who's infected is around you, just talking or sneezing or coughing, they actually can spray tiny droplets into the air. And then if you inhale those droplets, you could actually come down with the flu. And then the flu actually, unlike some other viruses, can actually live on surfaces for a period of time. So if someone, for example, sneezes into their hand and then touches a door handle, and you actually go and touch that door handle and then touch your face, you could get the flu that way. It's less common to get it that way, but it is one of the viruses that can spread in that manner.
And as you say, that Scoot, our resident germaphobe, if he's listening, goes into the fetal position. Why do you need a flu shot every year?
Yeah, so when you get a flu shot, your immune system starts to make the antibodies that protect you from the flu. But that protection doesn't last forever. It actually kind of wanes over time from the time you get the flu shot until you get your next one. And so what we do every year is we're boosting the protection that you get so that you can actually stay healthy. And then another reason why it's important to get the flu shot every year is that the flu virus actually evolves all the time. And like I mentioned, there's a lot of different types of flu viruses, but annually the vaccine changes. We don't know exactly what flu strains are going to be floating around from year to year. So they actually reformulate the flu shot every single year based on the experience of what happened on the southern hemisphere, so the other side of the world where it was winter. And so that's why it's important to make sure you get that flu shot every year, because it's going to be a little bit different.
I always wondered how they did that. You just clear that up for me. Who should get a flu shot?
Yeah, really anyone who's 6 months of age or older, so it's almost everybody should be getting a flu shot on an annual basis. It's really important, though, too, for people that are in high-risk groups, and that would be, the really young, the much older, and then anyone who's got serious health conditions. So, people with chronic health conditions that could weaken the immune system, things like diabetes, heart disease, anyone who's pregnant, and then, like I mentioned, older adults and then kids under 2 absolutely need to get a flu shot every year.
When should you get it?
So, we never know exactly when the flu season is going to come. It can be dependent on seasons and weather. Typically, though, it starts around October, and then it tends to get worse through the winter months, and then it starts to wane as you get into the spring. So usually the flu shot will come out in September or so, and so I tell people to go ahead and get it as soon as you can. That'll give you protection, as you go through the winter time. And keep in mind, it's not too late to get the flu shot if you don't get it when it first comes out, because we'll see flu all the way through Mardi Gras. In fact, we usually see a bit of a spike around Mardi Gras in New Orleans. So get it. Even if you haven't gotten it yet, you still have plenty of time to get it.
And you can go to what? Vaccines.com? Is that the website?
Yeah, vaccines.gov actually will give you an entire list of anyone that can provide a flu shot to you. And the good thing about flu shots is they're very easy to store, so most primary care offices have them, and all pharmacies have them available, so they're very easy to get.
I was set up to get mine at CVS last Thursday, but then I realized I had two events, one on Friday night, one on Saturday night, so I asked the pharmacist. She said, probably no worries, but it might be best to wait. And that brings us to side effects after getting a flu shot. Not anything, I guess, serious, although I'm talking about something that could make you feel like that's not at the top of your game, right?
Yeah. I mean, it is completely normal to have a mild reaction to the flu shot. That's really how you know it's working. Your body's creating those antibodies and having a little bit of an inflammatory response so that you've got that protection. But it can cause some soreness and some muscle aches, maybe a headache, even a little bit of a low-grade fever is not uncommon. And the side effects usually are gone by the next morning, so it's really not that bad. And like I said, it makes you realize that what it's doing, it's actually creating protection for you.
And my friend Shanika, the pharmacist, was just saying, you'll be able to go to it. You might just want to wait so you can have fun and feel at your best. So I'll go back and get it this week. We'll take a break here. When we come back, we'll talk about some common myths and concerns about flu shots with Dr. B, Chief Medical Officer at People's Health, Dr. Brent Wallis. 8:20, time for traffic now, WWL. 8:25, Tommy Tucker, WWL, back with Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health. We're talking about flu and flu shots today. Let's talk about some common myths, Doc, concerns about flu shots. Is the flu just a bad cold?
Yeah, the flu and common colds do share a lot of symptoms, but they definitely are different. They both have sore throat and coughing and headache, but flu is typically more intense in those symptoms, can definitely be worse, and can even lead to things like pneumonia. So colds rarely lead to other health problems, but flu can cause a lot of serious complications.
Let's take a young, robust man like myself in the prime of his life. Do I need to be vaccinated?
Absolutely. It's actually the best way to protect yourself, but also others around you. Most cases of flu are really mild, and really we do see a lot of impact, though, from those cases, even the mild ones. Hundreds of thousands of people go to the hospital and actually have to stay out of work. There can be a lot of higher risk complications as well. And so one thing you're doing as a healthy person getting the flu shot is you're actually helping to protect people around you who maybe aren't so healthy. So that's why it's important as well.
Does the flu shot give you the flu?
Yeah, it absolutely does not. I hear this all the time, but the flu shot can absolutely not give you the flu. It's actually made from little pieces of inactivated virus, so they're no longer contagious. They don't actually cause the flu, and you certainly can't transmit anything to another individual. So I have had people that have gotten sick after getting the flu shot, but they probably already had the flu when they got the flu shot.
And that would explain why some people do still get the flu after they get the shot?
Yeah, they definitely can. There's a couple of reasons for that, though. Keep in mind that flu shots are not 100% effective. Really, no vaccine is 100% effective, and the reason for that is because the flu, like I mentioned, constantly changes form throughout the year, and so they're really making a best guess in formulating the flu shot, and some years it works better than other years. So typically, if you get the flu after getting the flu shot, you either got a strain that was not covered in the virus, or like I mentioned, maybe you got exposed to the flu before you even had the shot. So it does happen, but it's relatively rare.
There's a lot of misinformation out there. All we can do is try. Are flu shots safe?
Yes, absolutely safe. And really, hundreds of millions of people safely receive the flu shot, this year and really over the past 50 years. There's continual research. The CDC really closely monitors any adverse effects from the flu vaccine and really all vaccines to make sure it's safe and effective. And really the flu shot is extremely well tolerated and very few concerns whatsoever.
In addition to getting the flu shot, what are some things that people can do to kind of protect themselves after?
Yeah, there's definitely some other things. Probably the most important thing you can do all the time, but certainly through the flu season, is wash your hands. I see a lot of people not do that, and it's really critical because this virus, like I mentioned, can transmit from surfaces as well. So you definitely, if you've been in a public place, if you sneeze or cough and perhaps you've got the infection, you could have it on your hands. So you want to make sure you clean and disinfect, your own body and then also surfaces around you, because that will actually help, reduce the transmission of flu. And then one thing you can do now, if you've got all those face masks sitting in a closet or a box somewhere, if you do think you have the flu, throw a face mask on there because you're actually protecting others around you. And if you're going to be in a really tight space, maybe New Year's Eve or something like that, wearing a face mask can prevent you from getting the flu too.
It is 2 weeks before Thanksgiving, right in the heart or nearing the end of Medicare open enrollment. Can you tell us a little bit, please, in the time that's left, how people can find out about people's health plans and about Medicare and all that stuff?
Yeah, definitely. I know we've talked a couple of times about Medicare. It can be very confusing. We are hosting a lot of in-person benefit presentations really here and all across Louisiana. You can find all those locations and dates at peopleshealth.com/meetings. We encourage people to come and visit us over at the People's Health Medicare Center in Metairie that's right on Veterans next to Party City. You can walk in or you can call us and make an appointment. We'd love to talk to you more.
You can go to peopleshealth.com, find out more, call them at 1-800-978-9765. Quickly, Doc, People's Health got that 5-star rating. There are only 32 the only one in the state, only 32 in the country, right?
Yeah, exactly. We're very, very proud of that because it's really a sign of the high-quality health care that we're helping to coordinate, and then all of the doctors in our network help to coordinate, and our members really love us, so that's great.
Thank you, Dr. B. Appreciate your time. Y'all can go to peopleshealth.com. We'll take a break, come back right now. Time for WWL First News. For that, we go to Ian Ozan.